talked about, the recommendations for vaccination have changed a lot over time. And just a few years ago, the age range was significantly expanded, so out to 45. So the majority of patients who develop HPV-associated cancers, especially oropharynx cancers, get these cancers late in life, in their 50s and 60s. What's pretty amazing or astounding about this virus is that you get these infections at your peak points of sexual activity, so that's in your 20s. And these infections stay around for many, many years, so like 30 years before you develop the cancer. So people now who are getting their cancers, it's too late. They had these infections 30 years ago. They missed their opportunity. So the time has passed for those patients. What we're focused on now is obviously trying to deliver vaccines pre-sexual debut, so in children before they ever expose the virus, and catch-up vaccination and shared decision-making vaccination. Those are the two other groups. Catch-up vaccination being 18 to 26, and then shared decision-making 27 to 45. And I think in those patients, it's the same barriers that exist in slightly different ways. So reasons that adult patients aren't vaccinated, I think are a few-fold. One, general vaccine hesitancy. It's true for all vaccines. Stigma associated, particularly with the HPV vaccine, because people think it's related to sex or making you more sexually active, which of course is not true. Access to care in general. Many adult patients who aren't vaccinated is an access issue. They have less interactions with the healthcare system. They came from outside the United States and weren't offered the vaccine. So those are the patient-centric barriers, and then there's the provider barriers that were already mentioned. I think those largely fall into changing recommendations and providers not understanding the new recommendations or being up to date on them, as well as not feeling, and this is supported by the literature, not feeling well informed to discuss this topic with patients. So if you poll primary care physicians, a decent percentage, don't feel comfortable explaining that actually throat cancers are caused by the, HPV, and they're actually more common than cervical cancer, and you get it through oral sex, and these kind of topics that people may or may not feel comfortable having those conversations. So there's a provider barriers as well, and that can be improved with education as well.